I think only like he admits.
So whenever I tell people that I'm supposed to be a sociologist, they're like, oh, then you should. You're interesting. Fun. Okay, do it. You can search it later. You can even have
Okay, it is great to see everybody. I'm really pleased to introduce Zhang, who is visiting us from East Carolina University today. Ian is a sociologist there and was trained at Michigan State University and then just finished a postdoc at the University of Wisconsin. And she's doing a lot of interesting work on various components of aging and also intergenerational relationships, and then links between marital status, sexual preferences, setups with children, adult children, and cognitive outcomes. So it's really great to have you today. Her talk is a number of children and older adults' cognitive function in the US, UK, and China. So
thank you so much. Thanks for such a nice introduction. Thank you for having me. Can everyone hear me okay? I will be as loud as possible. Yeah, it's great to be here. So for today's presentation, I'm going to talk about some ongoing projects I'm doing right now. So it's the association between number of children and older adults' cognitive function in like using data from US, UK, and China. And originally I was trying to put 3 or 4 studies in one presentation, but I feel like it's not realistic to complete all of them. So for today, I will just focus on 2 recent studies using UNC-Chapel data, the Chinese version of HRS, and I will skip a little bit on this like US project. So, okay. A little bit about my research interest from this like Venn diagram. My research question is from this like overlapped area, including like family demography, population health, aging, and life force areas. So I study how older people's like marriage, parenthood experience, their fertility history influence their cognitive function or risk of dementia in later life. And there's some earlier project focusing on older adults like sexual lives and how that influences their mental health, but that's not today's topic. So current research focuses on older adults, family relationships, fertility history, and the relationship to their later life risk of dementia or cognitive. So first of all, why do I study dementia and the cognitive function in later life? So worldwide, more than 55 million people have dementia, and every year, about like 10 million new cases. And globally, dementia is the 7th leading cause of death, and one of the major causes of disability and dependency among older adults. And I believe this number is like maybe the 8th leading cause during the COVID time, because COVID, one of the leading causes. And also because dementia, cognitive decline involves like high cost of healthcare and high burden on both the patients and the family caregivers. Probably another reason is like NIA is pouring money on this dementia funded for the projects. So yeah, I think they're cutting money on that. So that's one of the reasons. So this figure shows a report from the Lancet. It's very small. I was told I can use this. Like Harry Potter. So sorry, this is very small, but I just like those words here. So this figure just shows there are 12 potentially modifiable risk factors account for about like 40% of dementia in later life. So from early life, for example, like less education is associated with like around 7% of risk of dementia in later life. And in middle life, there are factors like hearing loss, brain injury, hypertension, heavy drinking, obesity. And in later life, there are factors like smoking, depression, isolation, physical inactivity, air pollution, diabetes. But the point is here, so at the bottom of this figure, it shows there are around 60% of the risk is unknown. So as a medical sociologist and also demographer, I'm thinking about how I can do something to identify potential risk factors or potential protective factors related to cognitive health or risk of dementia. So that's kind of a starting point of my research question. And the next question is like, why do I study fertility and parity? So it's not a new topic to focus on how people's fertility history influence their later life health and well-being. For example, like this study shows women who had been teenage mother had higher mortality and higher risk of poor health. And mothers with short birth intervals had a higher risk in some cohorts. In a famous study by Mirosky and Ross in 2002, they find their association between age at first childbirth and the depression. So early age at first birth, like younger than 23 years old, is associated with depression. And so there are many measures of fertility history, like timing, birth interval, the whole reproductive periods, and a parity, which is the number of childbirths, is one of the measure in like people's fertility history. And there are some studies find like parity is associated with health. For example, some study find there's like J curve between parity and all-cause mortality. So the J curve refers to both low parity and high parity is associated with increased mortality. But people who have maybe 2 to 3, 2 to 4 children, that's kind of like ideal number that is in the lowest risk of mortality. So that is the J curve. But I find not many studies focus on the relationship between parity and cognitive health or risk of dementia. This is like a long arm of parity, how that influences later life. So that is how my research question coming from. So, so for today, I'm going to talk about is a question that is parity associated with risk of dementia or cognitive function in later life. And basically, this is a question asking whether having more kids can like protect cognitive function in later life or harm the later life cognitive function. Anyone want to take a guess? The more the better or not?
No relationship.
No,
I'm gonna say it depends on the kid.
Depends on how much they sleep.
That's true. Yeah, yeah. So before I introduce this my studies, I want to talk about like the why question. I'm going to review some current literature showing mixed evidence in this topic. The first question is like the why question, why I assume there's a link between number of children and cognition in later life. What are the mechanisms, right? So, the current literature often use two frameworks to describe the potential mechanisms linking number of children and dementia rates or cognitive health. So one is the biological pathway, or some studies call it like a direct pathway. That is applied for women only because pregnancy is a unique female experience, and number of children or number of childbirths is associated with their reproductive periods. And that is a very important proxy to measure cumulative estrogen exposure. And there are some studies find is cumulative estrogen exposure is associated with women's brain aging and cognitive ability. But evidence is mixed. Some study find active effects, some study find no relationship, some study find is harmful. And also number of child births is associated with like women's comorbidities like risk of diabetes, cardiovascular disease, depression, and those are factors can have impact on later life cognition. And more complicated pathway is the social pathway or called the indirect pathway that applies to both men and women. So number of children can influence parents' economic resources, also influence parents like labor force participation. For example, like some moms have maybe 5 or 6 kids, they probably have to change their career choice, change their life planning, and probably in later life, those kids can be, they're more rewarding effects, they're helpers, caregivers, but in early life, they can be like a harm on their economic resources, like to raise a great number of children. And there's also like a parenting stress. And so some family demographers describe a parenthood experience is a mixed bag. Mixed bag includes both cost and rewarding experience, and life course perspective show this like linked lives between parents and children. So so if, for example, you have like demanding children, breaking up with children, or just have a negative relationship with children can be a chronic stress for a parent. And it can last to people's later life. For example, adult children may be demanding, not independent, or for like adult children, like success or failure is so related to their parents' life. So this is stress. And there's a lot of like scientific efforts have been made to study how this living with chronic stress can increase the risk of dementia, like early onset of dementia or the fast development of dementia. From a positive perspective, having maybe a great number of children is associated with more social engagement, because adult children is often the central figure of parents' social network. So for example, like children's visit, contact with children, receive like care from children, that can be a factor includes increase like parents' social interaction, social engagement, and that can be a factor promote mental stimulation. And a famous hypothesis is the brain reserve. So like our brain is like use it or lose it. So if you have a lot of interaction with people, and that can be a factor with mental stimulation, and can be a factor protect people's cognitive function later life. And adult children are often the primary caregivers. They can provide intergenerational support financially or emotionally, and that can be a factor can be like a positive mechanism linking lower risk of dementia. And also there's a theory called like a social control process. Adult children as caregivers may help parents to monitor their health, like reduce drinking, smoking, keep a healthy lifestyle. And that can be a potential reason to explain how having kids can relate it to risk of dementia. And definitely why it is like social pathways complicated, because there's like gender differences. We are not quite sure about how this like a number of children through this mechanism influence fathers and mothers in the same way or different, because like the closeness between mothers and children compared to the closeness between fathers and children is probably different. So there's a lot like family theories about like the gender differences in this intergeneration. So in my project, so besides talking about this mechanism, I also talk about gender. So in terms of current literature focusing on the association between number of children and the parents' cognitive function, it's very mixed evidence. Like current literature is far from conclusive. From my review, I believe a relatively large population of their relationships or deeper between 30 and 35. This is the study I conducted to use the HRS data, the health and retirement study from 2000 to 2016. It's like 6 years tracking and focusing on older adults aged 50 and older. So the x-axis is the women's number of children, and y axis is the probability of cognitive impairment. So it's similar to like a J-shaped. So women who have like one or two kids have a slightly increased risk, but women with this like 3 to maybe 6 kids in this like very low risk, and women with high parity show this like gradually increase the risk of cognitive impairment. But we can see the scale of the y-axis is quite small, and the confidence interval for women who have like a large number of children.
Do you have 0 kids?
No, this is just for example, parents. Yeah. So that's a group of literature showing that is the relationship between number of children and cognition. There's also a small group of studies show there's a protective effects of high parity on parents' cognition, and most of them use the female sample. For example, this study shows like the cumulative number of pregnancies can have like this mechanism of like cumulative exposure to estrogen have protective effects on women's cognitive function. And of course, there's some study find there's no association at all. So mixed evidence, it's not conclusive. So what are the limitations in current literatures focusing on this topic? First of all, in many clinical research, they have a small sample size of Alzheimer's disease and dementia cases. So it's often to see like less than 100 cases. So it's not very representative. In some population-based studies like HRS or this like HRS family data, they are large, but they have issues of like misidentification of dementia status. For example, in HRS, I find there are like fluctuations of dementia cases. So theoretically, if people have dementia, it cannot reverse. But if we see the data, I find there's a lot of people have dementia in wave 1, no dementia in wave 2, have dementia in wave 3. Probably because like reporting or some measurement error. So that's a kind of a limitation in those large scale data set. And another limitation is the use of selective samples. For example, like HRS focusing on older adults age 50 and older, but some of them are too young to track the whole lifespan to observe the onset of cognitive decline. And also because the sample size issue, many studies collapse the high parity into one category. So it's like having kids 1, 2, 3, 4, and more. So people who have 1 and 4 kids all in one group. So I wonder if there's any like internal heterogeneity between this high parity, like having 4 kids, same with having 10 kids, probably not. So, and also the gender differences not very clear. And like a majority of studies use female samples, but its impact of fatherhood on fathers' later life cognitive function is not clear. And causality is not. So in the following 2 studies, I was trying to answer some questions to address these limitations. But of course, I cannot answer all of them, but I'm trying to see if I can answer some limitations in current literature. And the first study, I examined the association between parity and Alzheimer's disease and dementia status using the UK Bank data. And some of you may heard of this study. Data. It's a very large data, include 500,000 people, and this data collected between 2006 to 2010. It's cross-sectional. The advantage is very large, and it's good for genetic studies because they collect the people's blood samples. So one of the innovation, I would say is innovation in this study is I used the proxy report of their parents' cognitive, the Alzheimer's or dementia cases. So the respondents in UK Biobank data, there's a question about asking them to report their parents did this history. So Alzheimer's and dementia is on the list. So so this is the question asking whether their parents have diagnosed dementia or they believe their parents have dementia. So compared to like a self-report on scores, so this is there's some like advantage to have this approximate report that can track the whole lifespan of their parents' disease history. So and like I said, UK Biobank is really large data sets. So we have a large dementia cases, for example, from respondents who report their mother's dementia status. There are 37,228 dementia cases like reported by their children, and like almost like 20K from like report their fathers have dementia. So the parity is measured by number of siblings plus 1, which means that is the total number of children. So I need a folder. Okay, so yeah, that's the that is the respondents' parents' total number of children. And because we have a large sample size, I can observe the full range of parity from 1 to 10. And we have a good power of analysis for like parents with more than 10 children. So more than 2,000 respondent parents have more than. Another advantage of this study is because the mean age of UK Biobank respondents is 56. So their parents have age more than 75. So that means they can have a full observation of their parents' lifespan. So if they have dementia or not, know that. Yeah, so that's kind of the.
Yeah, are these full biological siblings, or how are blended families handled by the survey?
Yeah. Wait.
So, like with half siblings
Yes.
or step siblings, like full siblings.
Yes. Yes. I believe that question.
Does UP back have some sort of information, self-report, dementia, or else, or they don't have proxy?
They have measures of cognitive. And I'm using their respondents report of their parents. Oh,
Do the parents have to be alive?
no. Some of their parents die. Probably like haven't.
Yeah, my other question would be, is this only taking into account living children? Like what if there were miscarriages or like later in life, you know,
I
deceased
didn't
cases?
include that variable. I think there's a variable of miscarriage. I think you could have have that variable, but I didn't know how to like combine them.
Yeah.
So yeah, I was thinking about maybe to track the whole variables, but this is the
Yes.
to look at.
Thank you.
So my chart shows number of children. So we can see a majority of people have 2 to 3 children, but we still have quite a large sample size for parents who have more than 8 children. For those who have like more than 10 children, there's like more than 2,000. And the father sample is in a similar distribution. So that number, that refers to respondents who report valid data of their mother's dementia status. So some have dementia. And I jump to the results. So So the method is quite straightforward, it's like just a logistic regression because the outcome is binary. And I don't have a lot of controls. I only control for children's age and the parents' mortality status because some of their parents died and some of their parents alive. And one of the limitations of UK Biobank in terms of this study is there are not many like demographic information at parental level, so I cannot put a lot of control variables here. So basically, it's the story is there's a negative relationship between number of children and with the risk of dementia. So this is I would say this is a surprising result because the more kids these older adults have, the lower risk of dementia. So remember, like the large group of literature that I just talked about is there's like a J curve that is a association between high parity and cognitive decline. So this is a surprise. So it's more kids matter, the lower risk of dementia, and this effect is stronger for mothers. We can see for fathers' results, there's a like drop after like number 8. But compared to mothers, this effect is more flat. Yeah.
Do you see the same effect for parents' mortality, or is it relatively flat? If you were to look at parents' mortality,
Yeah.
are they more or less likely to die depending on the kids they have,
Oh,
like age of death or something like that? Interesting.
no, I don't think I had that. But it's
I'm just wondering if they pass away earlier and never have a chance to have dementia. I just don't know. I'm
yes, yeah.
throwing things out at you.
So when I try to explain why it is a surprising result there, so probably there's a selection effects. So those who live longer, who are healthy, are more likely to be. It's possible.
I just have another question about the sample. So like, I was just wondering if like multiple siblings from the same family are like included in the sample with the same parent, like, do you address the,
Yeah,
or is there a way to like see if that happened?
that's a good catch. Yes, because it's very large
Yeah,
and it can include siblings like share the same parent.
and that's included in the regression, like in the sample that you're doing the regression.
I did some extra past, I don't know if this is related to your question, but because I don't have a lot of control variables, so how should I like exclude those factors at parental level? So I try to control the sibling effects, like the shared family background at parental level. So in UK Biobank data, they have the genetic index. So use that index, it's called like a kinship index. Use that index, if that index, for example, within this threshold, that means these two person, they have biological connection. So they could probably siblings or cousins. So using that way, I can find cousins in this sample and the cousin parent are siblings. Yeah. So that in that way, I can control the early life environment or shared family background at parental. I lost some things that result in line of the conclusion.
I'm just curious about your proxy measure. If you do have siblings, to what extent do their reports agree?
If they have siblings,
Well, if you have siblings in your data set and they're both reporting on the same parents, how often do those reports agree?
really good question. I exclude those mismatched cases. I find if they report the same status. If they're not, they report different status. I cannot tell who are telling the truth. So I just like drop a small group of people who report like different status of their parents.
Any guess about what percentage of your sample that it's a sort of a way to think about the measurement, proxy measure.
Don't remember the exact number, but like 1 or 2%.
Okay, thank you.
Not that big.
Yeah, another question on the measure. Is it specifically asking about like like a medical professional making a diagnosis, or is it like a personal observation of
I think it's
cognitive
both.
function? Oh, it's both.
Both.
Okay.
So, if they observe their parents have a diagnosed dementia, they report that. Or if they observe they have dementia symptoms. So it cannot be perfectly, I mean, always like, probably there's like these reports.
Yeah, I also wonder if there's something about like familiarity with your parents and like the
Yeah,
number of
yeah.
kids.
Yeah. Mm. I cannot tell from the
Yeah.
measures.
It seems like there is a very obvious different pattern for father and mother from previous literatures or from what you're understanding, like, are there any explanations we have to understand the story?
That's why I think the gender difference is not quite clear because, like I mentioned, the mechanism is complicated, including both biological and social pathway for mothers, maybe two mechanisms will work. Experience like pregnancy, motherhood, worries, all these different experiences. Okay, by the way, I have a study too. So, oh, sorry.
No. I would just follow up on that and Jeremy's point. Could be a very simple explanation of mortality because male on average lives 3 to 5 years shorter, and the mortality selection is happening, and males, not age, the dementia risk is lower because of mortality selection. No, that's a comment.
Yeah.
I have a question. In this sample, you said there aren't necessarily reported blended families and maybe not adoptive children, but are all children, is the whole sample two parent, opposite gender parents? Are there only two parents in every?
No, they just report whether their mother have or their father. So we don't now know whether they report both parents or just one parent or.
Okay.
Okay. How do you feel? Or to the second question, the second study. So the second study is based on the Chinese context. So this is still associated with parity and cognition, but I'm trying to use like an instrumental variable approach to figure out is there a causal relationship. Because I work with a lot like economists, they really care about this causality. So it's like I must use IV method. So that's kind of the reason why. I mean, like there's no harm to explore some like causal relationships. But this study is very like exploratory. Sometimes we feel like we never see a paper like this. So why do I conduct this study? So one of the reasons is like previous research barely show the causal relationships, even though it's like a longitudinal analysis, it's kind of hard to say that it's causal. Another reason is like I was inspired by this paper published in Demography in 2022. This is a study using the share data. That's a European version of HRS. The predictor is number of children, but they use the interesting IV, which is the sex composition of their first 2 children. So the idea is if parents who have their first children is same sex, so like 2 daughters or 2 sons, they're more likely to give the third kids. So that is the IV, and that IV influencing the number of children, and using that way they examine how the parity influence parents' later life cognitive function. And a major finding is that they find the parents who have 4 kids have lower cognitive health compared to low parity. Yeah, that's their major finding. So inspired by that, I feel like maybe I can leverage the one-child policy in China and use that as a IV to explore the relationship, the causal relationship between parity and cognition. Because this is a very unique policy, very unique context in China. So the data we are using is the trials. That's the Chinese version of HRS. We use 4 weeks from 2011 to 2018, and the final sample includes about like 20K respondents. The parity is number of biological children ranges from 0 to 12, so it includes childless people. I will talk about this more later. So the outcome is a self-reported cognitive score that is like consistent with those measures in HRS sister data sets. So it's ranging from like 0 to 30. So the higher score means better cognitive function. That includes like mental stature, episodic memory. So there are questions like words recall, meter words recall, delayed words recall. Also some like numeric reasoning questions. And we add a lot of covariance, and the method is the IV approach. I don't know if you're familiar with this IV, the instrumental variable approach. So the idea is like the one-child policy influences people's number of children, but there's no direct impact on cognitive function. So in this way, we try to figure out the causal relationships. However, a big challenge for us is how we should measure the one-child policy. So there's no golden standard here, say, oh, this is the measure of one-child policy. So we reviewed a lot of literature to see how different people use different measures to measure that policy. So instead of like picking just one measure, we conduct like a comprehensive review and test many potential IVs. So there are some commonly used measures, such like a type of hukou. The hukou is like the government registration of whether you are rural residents or urban residents. So if you are rural residents, you are allowed to have the second kid, your fourth kid is daughter. And for urban residents, you are not allowed to have a second kid regardless of so that can be a factor influence the one-child policy. And ethnicity, if I'm Han, that is majority, the policy is more restricted. If you're a minority, then there's more flexibility to have more kids. Gender of the first children, that is a similar idea with that, the demography paper. So if the first kid is a girl, some families may want to have a second or third kid, regardless of the parity. And also the established year of the policy. Officially, the established year is around like 1979 to 1980s. That's around the time of the formal policy get started. So we use these different combinations of these different measures to measure the one-child policy. Okay, this is, I know, like it's a lot of information, but we just like summarizing all the potential IVs, like from previous literatures, and you can see this includes like a gender of children and also a combination of different factors like the hukou, the ethnicity, timing of the policy, or even like the distance between the childbirth year and the starting year of the policy. So it's complicated. So the idea is like at the first step, the first stage, we do the F test and find what are the good measures of one-child policy. If they didn't pass the F test at first stage, we don't use it. But those are or we call them good IVs that we can use in the second stage. And we also do test in total sample and by gender, and we find that, okay, those variables, those IVs we can use in this stage. Okay, so in the second stage, this is a coefficient showing the relationship between parity and cognition. I know it's a lot. I don't like these tables, but that's kind of the best way I can show these complicated results. We're trying to figure out what the general pattern here, because there's so many different avenues. The general pattern we find is most of the coefficients are negative. And so we can see a general pattern is the high parity negatively influence cognitive function in total sample. But in terms of gender differences, we are still exploring what is the gender difference is. So I would like to know more comments about that, because we didn't find there's like a clear pattern like between others and others. Yeah, if you have a question, we can come back to this slide. So a quick summary about those like studies, this group of studies exploring parity and cognition. So studies based on the US data like HRS, I found it like J-curve, and using UK Bellbank data, there's surprising results. It's like the more kids you have, the lower risk of dementia, but that's probably because it's like a different cohort, the parents cohort. And the study based on China, leveraging the one-child policy using IV method, the general pattern we find is it's consistent with the large group of literature, so high parity is associated with cognition. So after today's talk, when you talk with your friends, family, say, okay, I have 5 kids, do I have a high risk of dementia in my life? Or I want to protect my cognitive health, should I just pick 2? So every time when I talk about this like implications, how this study is useful, I feel like instead of saying that, this implication can be more broad. For example, I think about like older adults, what's the cognitive health implications in low fertility in East Asian, North Americans, and many European countries? It's an aging society with a low fertility. So the conclusion, if the conclusion is like a high parity associated with birth cognition, that means the hypothesis about like the children's return, or like children have caregiver will not work. Like you have a lot of kids, but actually that doesn't help to later life cognition. So the mechanism I just talk about, like the children can increase caregiving, can increase parents' social interaction. That's true. And also in another study using NHATS data, I find that I control both like marital status and number of children, and the outcome is the care and med care, not about dementia. But the funny thing is, we found that the more kids people have, the higher unmet care needs they have. So I don't know, maybe like siblings don't want to share the responsibility compared to a single child. So that's kind of like one of the implications I can think about, like what the care needs of older adults. And another thing is what in terms of the Chinese impact of fertility policy or family planning policy on older adult health and especially cognitive. And also, public health people like to ask what kind of intervention we can make to prevent this risk of dementia. And I would like to know more comments about that. So some future directions can be, instead of just looking at number of children, if we can have a variables to measure the relationship quality between parents and children, and that would be very helpful to understand what's going on here. Why have like 5 or 6 kids that doesn't help to increase like promote cognitive health. So I know like HRS data have this leave behind questionnaire, includes a lot of interesting variables to measure relationship quality between family members, friends, children. So there's an ongoing project to see that, but a lot of rejection. Also, another question is like, are you just looking at parents with different number of children or parents versus non-parents? So that is interesting topic to explore. So it's like the number matters or it's like just having kids or not. So so in the project I use the NHAS data, I find that no matter the number of children older adults have compared to childless people, parents have lower risk of dementia compared to child. But there's a lot of things can explore about this childless older adults, whether people being childless by choice or not, whether they have other like economic resources to, for example, purchase paid care, other helpers. So there's gonna be a lot of things to explore. So another thing is to explore the interaction between marital status and fertility history. For example, like parents who are divorced or widowed have 5 or 6 kids compared to childless parents who are unmarried. It's just like a different typologies of this marital history and child rearing biography. So I think maybe in the future I can draw a more comprehensive picture, including both marriage and parenthood. And also like what's the ratio? I tried to test this like racial interaction in my studies, but I didn't find significant. So it's not clear. Yeah, that's it. Perfect. Great. That's really.
I'm gonna apologize. I'm gonna comment, so just. I got fixated on the IV and I've only spent 5 minutes thinking about it and you spent forever. A question I had though was that a big component in the IV, or at least certain of them, was the urban-rural differences. And I was wondering if you.
Study too.
Yes, study 2.
Oh.
I was wondering if you could go like in a pre-time period and see if there is a urban-rural difference in cognition. To see if that's driving it or if it's the one-child policy.
Yeah.
Or if you could just focus on the rural and use that group and see if you see a similar effect. Something like that.
I'm sure there's a lot of study out there looking at the rural and urban differences in terms of cognitive function. And I believe the consistent finding is like rural people have lower cognitive.
And I was worried
scores
if that was.
urban. And one of the reasons is the education or the access to healthcare. We control that variable. So that's also a question I have. Like I posed rural urban in the instrumental variable. How do I deal with that?
Well, I mean, you could just look at the rural group, like that sample, and see if you see a consistent result for that group.
Like separating.
Like using the gender component, but just looking at the rural, like rural person.
Oh, okay, very good.
And see if you see a similar result just for that group. I don't know. 5 minutes is all I've had.
Yeah, and Jeremy taught me IV, so I'm also fixated. Yeah, on the face of it, it like seems very plausible that the one-child policy doesn't affect cognition, but it did seem like even beyond the urban rural, that some of those measures might also have a relationship. And I don't know much about the Chinese context, but I don't know if like minority ethnicity is correlated with the same sort of like social deprivation and discrimination that it is in the US. So it seems like the overall policy seems exogenous, but the proxies seem like they could. So could you also measure validity in addition to strength? I guess is my question.
My understanding about the question is like, we cannot just say there's no impact, no direct impact from the policy to the cognition.
If you're measuring it with proxies that could also influence cognition.
It's what the shape of the cognition parity relationship in China looks like without the instrumental variables. Like if you did it same way you did the US ones or the UK one, like do you see the positive relationship, negative relationship, no relationship?
Yeah, I believe some literature is not using the trials data, but other data sets find hair parity is not good for.
Oh.
Not using it.
Yeah, outside of, yeah, and you haven't looked at your data, I guess, you've done the instruments, but not the relationship without instruments.
I can test that.
It'd just be interesting to
but-
see whether the instruments sort of like confirm or switch around what you
Yeah.
see without.
The color,
instruments.
yes.
Yeah.
Right. Maybe I will add a tab like that.
Yeah.
So I'm curious, I was thinking about relationship quality, and of course, if your kid is dead, then you wouldn't have much of a relationship with them. It got me thinking about, is this parity or children who are still living? And that's relevant to some of your mechanisms, right? If it's the help that they provide in the social interaction, it would be living children, versus some biological mechanism, maybe it's parity, all kids. Related to that, got me wondering about miscarriages. Got any information about that?
Yeah, some literature, wait, so the first question about living children, is that the children who are alive? Or,
In these, are you measuring, when you measure parity, it's
Yeah.
all the kids they've ever had, period, whether they're alive or dead now, is that right?
yes, I don't think we can exclude if they experience any like the loss of children.
So you don't have a measure of living children?
But I need to double check. whether
I would
it's
check
living
that.
or not.
Yeah, I think Charles has that.
But what I think about is like parents who experience loss of children, that is a trauma time that independently influence their. But go back to the second question.
Yeah, I'm just curious about miscarriages, if there's a biological mechanism. I just was wondering if that's where you might. see
Yeah, some literature they explore the whole bunch of reproductive factors, including miscarriages, stillbirths, age at menopause, age at birth, childhood, whole bunch. I don't remember like a clear like relationship between miscarriages, but there's some studies to look at cumulative month of pregnancy, not just number of childbirth, or not just number of children. I think in the future there's gonna be more studies to put them together. To see, that's why I think that the typology of the child rearing biography that can use some like a latent class method to figure out the whole, to add everything together and figure out which makes difference. Yeah, and I think that also can be a way to figure out the biological pathway.
Well, the same with the difference between a parity effect and a living children effect, right? That helps you sort the biological and some of the social mechanisms. Yeah.
You might go back to the first slide of the graph of the US HRS data, that's J curve. So if you look at J curve, I think to me, the interpretation is very simple. If people ask you having 5 kids, that's beneficial. Your J curve is exaggerated by the sample size itself, and the reality is most of kids in this society on average have right now, the TFI is 1.7-ish and the average maybe 2-ish. And the number of people having 6, 7 kids is very rare to start with. Having 5 kids is safe.
Probably that's also the reason why that the UK development data shows. I mean, the surprise, the opposite.
Not the opposite. If you just, when you look at the large confidence interval, I don't think I would put too much weight on that data to start with. So I think if people ask you, is it okay to have 5 kids? Sure. Not a problem. At least the evidence shows.
At least from your.
Not a problem.
At least the concern of.
So definitely, I think a more study needs to happen with robust study because this study also used HRS data. They found there's no association between parity and women's cognitive health. And I think don't remember why, but I think we use some different method. I'm looking at this like non-linear relationship.
What does the literature say about how much protection against cognitive health is a factor in people's family planning decisions?
How much effective?
No, like when people are deciding whether or not to parent, to have children, how much are they weighing like future cognitive health compared to all of the other decisions that you might think about, like, can we afford to have children, or do we have enough time to have children?
I don't know if there's any literature particularly on that. But I believe some literature is on like like different findings in childhood. It's like there are any benefits or it's like harm for the cognitive health. So I don't even like related because people have like different choices of being childless in their life. So we cannot just say, okay, being childless is definitely not good compared to parents, regardless of number, but yeah, we just don't know the decision. And also another interesting literature show the deviation between the desired number of children and the actual number of children. So they find that it's not the number of children, but the expectation, the deviation matters.
I would be curious to see in the results of the US study that you did, like, to stratify them by like parental co-resident status. Because if we're thinking about like a stress or a biological model, I would imagine that like being a single mother might be a lot more.
Whether they live with their parents.
Yeah, or whether the parents live together.
Oh,
whether they're,
okay. The living arrangement of parents.
yeah.
Whether they like separate or family or not or living apart.
What was that?
So a living arrangement of parents.
Yes, yeah.
What's your hypothesis? Like,
I guess like from a life course perspective, if we're thinking that like stress accumulates over the life course and to some extent, like that stress exists in the home based on like the amount of caregiving that the parents have to do for the children before they need care themselves. Like if that increases the risk of dementia as an older adult.
right. So the living arrangement.
Like prior to this sort of, yeah. Like in
Time spent with
addition,
the kids or the parenting stress or
yeah,
relationship or interaction.
yeah.
In HRS, we can add that variable, like
Yeah.
whether the parents living together or not. But I just think about like the stress, how it can be a measure of like stress.
Mhm.
Yeah. Sorry, I didn't correct answer that question.
No, yeah.
Okay.
It was just like me thinking out loud.
Yeah.
I'm curious, in your model, do you control the health, like health conditions or health status?
Yeah, I control like both health, physical health and mental health. So physical health is like, it's like an index of chronic diseases, whether they have diabetes, high blood pressure. So it's like 7 diseases together, and mental health is depression. Yes.
One last question?
It was more or less a follow-up comment on that. I was following your same wavelength with the idea that having one parent versus two parents in the household definitely increases the burden or the load of parenting on
Yeah.
one versus two parents. So that's, I think, why she was emphasizing that specific point. And so I do think it's something important to consider because the burden of parenthood when it's shared across two people is
Yeah.
much different than just being
Yeah.
a single parent or having your kids part-time.
So I guess so we're talking about this parental stress during like the time they have like minor children or later life. Because we have measures of their living arrangement in later life, but we don't know whether they are living together or not when they have this stressful parenting time.
Yes, that's what I was
So-
mostly thinking was, specifically like, very young children, infant, toddler, young adolescents,
Yes.
like those
Yeah.
really critical time periods where you have to devote a ton of time and energy into child rearing.
Yeah, probably I can consider the age of their children, so probably they have teenagers and also adult children, how we can evaluate the effects of parenting stress. Mix.
Just something to consider, that's all.
Yeah. I'm surprised, like, people ask me a question about like children's gender. There's I guess one of the reviewer asked me, how's and also like one of the questions from the group discussion, so the sex composition between parents and children. Like daughter and mother, son and father, daughter and how that make a difference to influence the interaction or caregiving, like time or emotional support.
Great. Thank you very much.